Andy in the attic here. The sounds above my head are the seagulls. It is the season of seagull love. So I apologise for the unusual noises. It's not me, it's them. NLP and cancer. Someone sent me over a copy of an NLP training manual. I shall not name anybody, but I shall read you from the manual. Now, as many of these things do, and you'll see the same thing on YouTube videos and TikTok and all the rest of it, there's always the medical disclaimer, which is this is for educational, informational purposes only. This is not to give medical advice. You should always consult your doctor, etc., etc., and then they go on to give you quite explicit medical advice. Well, that is the case for this particular training manual. Now, there's pages upon pages of how to heal every disease known to man. I'm going to go through two of them. Their healing paradigm for cancer and their healing paradigm for AIDS. Now, this is not some fringe group. This is not some fringe group. This is a mainstream training NLP organization. This is not fringe. I shall read you. Cancer, present at all time in our bodies. Why does it get out of control? According to Matthias Rath, MD, the proliferation of cancer cells happens because of the breakdown of the collagen that is in the surrounding tissue. Vitamin C, ascorbic powder, and the amino acids lysine and proline have proved to either have the cancer disappear or reduce dramatically without any side effects. Also very beneficial after surgery. What trauma or significant emotional event occurred 1 to 3 years before onset? 40,000 cancer patients studied all had significant emotional events before onset. Think about it. In the last 3 years, have you had a significant emotional event? Ask anybody at any stage in their life. In the last 3 years, have you had a significant emotional event? Just saying. Linked lesion in brain, location of tumour in body, type of emotional trauma. So there's a relationship between the type of lesion, its location, and the type of emotional trauma. When the client has negative significant emotional events, no strategy to cope, obsesses, doesn't know what to do, they may develop cancer in 1 to 3 years or less. Significant emotional events cause lesion in the brain. The brain sends the wrong info to the body grows the tumour. Client goes from operating in parasympathetic to sympathetic nervous system. Brain lesion gets edema, visible on CAT scan in the healing phase. They may need to change lifestyle, environment, conditions in and around. Without changing the environment and conditions, the cancer can heal but can come back later since the same triggers are present. This is an NLP training manual. Mainstream. Chemotherapy uses mustard gas and blows out the immune system. University of Calgary Oncology Department teaches doing study on cancer, blah, 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 blah. And he's quoting here Andrew Wheel, MD, Natural Health, Natural Medicine. Yeah. Task, read everything in the series Cellular Health by Matthias Rath, MD, especially the book on cancer. If the body is in perfect health and has sufficient nutrients to maintain perfect health, the immune system can easily destroy any cell that has mutated. Most people lack vitamin C. The human body does not produce vitamin C and the amino acid lysine, which it can't produce either. Robert Atkins, MD, recommends targeted supplementation of nutrition for the prevention of cancer as well as for cancer survivors who want to avoid recurrence. Not the case if the root cause of the significant emotional event is gone and the client is taking action. Most important, selenium 200-400 micrograms, natural source beta-carotene 20,000 to 40,000 international units, vitamin E 400-1200 international units, lipoic acid 50. This is not medical advice. It's informational purposes. Essential oils, 7,200 milligrams. Vitamin C, only as ascorbic acid powder after meals, 5 to 10 grams. Folic acid, 5 to 10 milligrams. Zinc, 100 milligrams. N-acetylcysteine, 1,000 milligrams. CoQ10, 200 to 400 milligrams. Quercetin, 600 milligrams. And other and other flavonoids, mushrooms, reiki, shiitake, and maitake, 20 to 40 drops, moderately important, in capital letters. Lycopene 12 milligrams taken with dietary oil, modified citrus, pectin, acidophilus, bifidus, bulgaricus, highest potency, half to 1 tablespoon. It just goes on. It's not medical advice. I'll skip all the rest. It just goes on and on and on. Women who need to shrink uterine fibroids, prevent breast cancer recurrences, or deal with endometriosis or fibrocystic breasts should keep supplemental folic acid below 600 micrograms. This is not medical advice. Avoid excess iron supplements, can increase the risk of cancer. Avoid iron supplements and foods fortified with iron unless you are iron deficient. Avoid the use of polyunsaturates such as safflower, sunflower, and corn oil. This is not medical advice. Right, so now let's move on to the healing paradigm for AIDS. Yep, NLP can cure AIDS. Schedule 8+ hours as a minimum. Do 40% interview, 40% intervention, 20% testing. General paradigm for AIDS intervention using this particular NLP approach. Note idea of blueprint for perfect health. Cite Deepak Chopra. When did they choose to have these symptoms? I'll read that again. When did they choose to have these symptoms? I'll read it again. This healing paradigm for AIDS. When did they choose to have these symptoms? I'm sure that probably involves some hypnotic paradigm, setting up some finger signals, put them into deep trance and ask your unconscious mind when your unconscious mind chose to have these symptoms. This is not medical advice. This is not therapy. This is not psychotherapy. This is not treatment. It's neurolinguistic programming. That's different, apparently. It's different. Check for secondary gain. Ask why did the unconscious mind choose to create the disease. Let me say that again. Ask why did the unconscious mind choose to create the disease. Check values. What's important about living, not just health. What's important about living. Who did they model in youth? Connecting health, power, projection, get self-image. Who did they model their health on? May have had extreme external frame of reference. Yeah, because if you've got bad health, it's because you modelled it. You modelled it. You learned to be ill by modelling. Modelling. Ask what are they willing to do to be healed. What are you willing to do to be healed? Are you willing to pay my fees for these 8+ hours as a minimum session? Yeah. What needs to be done to become well? What needs to be done? No, loosen frame of reference towards becoming well. Matthew's Wrath again. There's a quote here. The health improvements of a patient were achieved following a nutritional health program without concurrent ARV drugs, antiretroviral drugs. Just after a few weeks of symptoms of AIDS, including ulcers, skin rashes, joint pains, fatigue, and other AIDS-related symptoms, significantly decreased or disappeared completely. Thus, with micronutrients alone, the AIDS patients could reverse the symptoms of AIDS and lead almost normal lives again. I'm guessing they've never come across Kaposi sarcoma. I don't even know where to begin. A simple daily vitamin pill can delay the progress of AIDS in HIV-infected women, an 8-year study at by Harvard researchers has found. The study suggested that the vitamin supplements could be used in developing countries to delay the need of AIDS drugs. Yes, because in parts of the world where AIDS is so unbelievably rampant, malnutrition and poor water quality is also rampant. But let's not get into details and facts. A simple... 14. This particular NLP technique can get rid of all negative kinesthetics based on guilt, shame, youthful programming, even if they got it from a blood transfusion. This particular NLP approach can get rid of limiting decisions to have disease. Apparently you have limiting decisions, that's why you've got disease. Parts integration to integrate the virus and immune system. Okay, because virus and immune system are parts, and we can do parts integration on that. Hypnosis to ask the unconscious mind to heal the body using a pendulum. Why don't we invoke the spirits while we're at it? Future pace for people who don't believe they're better. Okay, let me say that. Future pace people who don't believe they're better. You are getting better, but I'm not. You're getting better. Timeline therapy techniques to future pace doubting Thomases at home. I've got doubts. You've got limiting beliefs. I don't think this is working. You've got limiting beliefs. Pendulum to increase the T8 cell suppressors. Yep, you can use a pendulum to increase your T8 cells. I bet these people don't even know what a T8 cell is. And a pendulum set date when healed. Use pendulum to change the chemistry of immune function whilst healing. It goes on and on and on. But they're not doing therapy, they're not doing treatment, they're not giving medical advice. No. It's a training course for informational purposes only. If you've got a manual like this and you want to send it over to me, I've got loads more to go through yet. Do send them over. I would love to see it.
This is NLP.